A 73 years old man developed sudden onset abdominal pain with collapse. On examination, he has tender pulsatile mass in the upper abdomen, blood pressure 90/60 millimeter mercury, pulse rate 105 beats per minute. Which of the following IV fluid regimen is most appropriate whilst waiting for the operative repair? So first of all, let's see the diagnosis. That means a patient suddenly develop abdominal pain and collapse, and after that the blood pressure reduce. That means patient going to shock. Also pulse rate increase. So blood volume, blood pressure reduce, pulse rate increase. It is the hypovolemic shock, and the cause of the hypovolemic shock in this case is the rupture aortic aneurysm. So rupture aortic aneurysm, and here we are waiting for the operation, but here we find the abdominal mass. That means there is contained hematoma. That means the abdominal aortic rupture, and fortunately the patient, their hematoma of the rupture, and it is now in the clotted form. So what we can give up to the operation, and we have to give the fluid that which will not increase more of the blood pressure, which cause disloss and again bleeding. So we have to give a smaller amount of fluid or longer duration. So here the options are 1 liter of pentastas over 15 minutes, 1 liter of heartburn solution over 4 hours, 1 liter of Gelofuscin over 30 minutes, 1 liter of heartburn solution over 30 minutes, and 1 liter of the blood over 15 minutes. I think it is very clear that all are the 1 liter. So we should give the highest duration. Now let's see the pathology. Here we can see this is showing the abdominal aorta. Here we can see this is the abdominal aorta, and usually the common location is the infrarenal, and here we can see the aneurysm. The aneurysm may present here, also present here. So what happened? The aneurysm may be rupture, but in some fortunate patient, what happens? In some fortunate patient, this ruptured area, it usually blocked by the thrombus. So the thrombus attack, the thrombus block this area. So how we have to give the fluid? We have to fluid very cautiously to prevent the rupture of the thrombus. For this condition, we have to give fluid very slowly, very small amount. This vein will have contained hematoma. So this is the cause. That means there is a rupture occur, and at the rupture point there is the hematoma formation occurs, and he is waiting for the surgery. So if we give the rapid high volume infusion, it may cause the disloss of the hematoma and again bleeding, and finally collapse and death of the patient. So we don't want to death of the patient. For this condition, what we do? We want to do permissive hypotension. That means the fluid in very smaller amount to reduce the risk. So what we can give? It is 1 liter fluid over 4 hours, not 15 minutes, not 30 minutes, not 30 minutes, not 15 minutes. We have to give very slowly over the 4 hours. I think it is clear.